Well, prostate cancer is the most common cancer in men after skin cancer, but many men don't know about their own risk.
Yeah, so what do you or the man in your life need to know? And when should you start getting screened for prostate cancer? Well, the Fox Medical Team's Beth Galvin has some answers.
Your risk of prostate cancer depends on factors like your age and your family history, and there's still some debate over when the average risk man should start getting tested and how often he should be screened. So we asked a local Atlanta surgeon for some help.
Screening for prostate cancer starts with a simple blood test called a PSA, or prostate-specific antigen screening. It can pick up the first warning signs of cancer. But when should you start getting tested? And how often do you need one of these screenings?
The message gets very confusing.
And Dr. Scott Miller, director of laparoscopic and robotic surgery at Northside Hospital and Georgia Urology, worries that many men are getting so many mixed messages, they're not sure what they should do.
Probably the mistake I worry about the most when it comes to prostate cancer is people doing nothing, never going to a doctor, never getting a screening, not finding out what type of screening is right for you.
The problem? Assessing risk is an individual thing. Dr. Miller says some men are low risk and need minimal screening. Others are higher risk and need closer monitoring.
So someone that is African American, for instance, particularly if they have a family history of prostate cancer, that person should definitely start screening at age 40, in my opinion. Someone that has no risk factors, you can still make an argument, get one PSA at age 40.
After that baseline test, Dr. Miller says low-risk men can go up to 10 years before their next screening, though he doesn't recommend it. What he says you don't want to do is wait for symptoms, like a frequent need to urinate, because by then, the cancer may already have a foothold.
And once a man has symptoms from prostate cancer, it's often beyond the point of cure. We can still treat them, but it's often beyond the point of cure.
So what can you do to lower your prostate cancer risk? There's still some debate about that, but the Mayo Clinic recommends a low-fat diet, plant-based fats, lots of fruits and veggies, fish, and cutting back on dairy. And Dr. Miller says you may want to watch your sugar too. He says any diet that's considered heart healthy is probably going to be cancer healthy too. For the Fox Medical Team, I'm Beth Galvin.